Welcome to today's webinar. Thanks for joining us. My name is Donna Marin. I am a registered nurse and a practice advisor here at the SRNA, and my role today is to help facilitate this webinar. Before we start, I'd like to acknowledge that we're presenting from our office in Regina, which is on Treaty 4 territory and homeland of the Métis. Our topic today is titled Cadth 101. And our presenter today is Krista Bergquist from the Canadian Agency for Drugs and Technology in Healthcare. She is a program advisor in Saskatchewan with Cadth. Before we get started, I have a couple of notes about how you can engage throughout the presentation. As a viewer of this webinar, you'll be able to hear and see the presentation, but only panelists will be able to speak throughout the presentation. If you have a question, please your questions into the Q&A box or the chat sections. We'll be monitoring this area for questions throughout the webinar, and these questions will be answered either live or via a typed response. If you wish to send your questions anonymously, check the box at the bottom of the Q&A screen. We will be recording this webinar and it will be posted on the SRNA website for those who are not available to join us today so they can view it later. An email will be sent to you with a link for an evaluation. We hope that you'll take a couple of minutes to complete this quick survey. Now that we have those housekeeping items out of the way, I'm going to turn the microphone over to Krista. Welcome.
Thank you, and thanks for inviting us today. I think it's a good opportunity. We have some changes going on at Cadth, so we thought as a presentation, it would be a good opportunity to do an overview of who Cadth is and some of the changes that are going on for people who aren't already familiar with Cadth. Can you hear me okay, Donna?
Yes.
Okay, just making sure. So for anybody who isn't aware, Cadth is an independent not-for-profit organization responsible for providing Canada's healthcare decision makers with objective evidence about the optimal use of drugs and medical devices. So that being said, Cadth was created with the intention to build Canada's capacity to use evidence as the basis for how we make decisions in healthcare. So Cadth was created in 1989, so it's a fairly long-standing organization and has always maintained a customer-focused approach on our products and services. So I will be going through the different products and services that we do offer. But in that being said, because we do try to have a very customer-focused approach, we always encourage people to contact us, whatever their needs are, whether it be myself or Allison Friedman, who is our interim liaison officer in Saskatchewan right now. She's filling in for Kathleen Kulik, who's on maternity leave. But it's always great because even though, you know, we do have our defined products and services that we do offer at Cadth, sometimes if things are a little bit out of the box or out of scope of it, we can also find ways to help support you in your needs. So we always encourage just that dialogue, that ongoing dialogue. So again, our vision at Cadth is that health technology assessment informs every health technology decision. And our mission is to enhance the health of Canadians by promoting the optimal use of health technology. So basically, our aim is that decisions are made in healthcare by utilizing the evidence, and from that, we'll enhance the health of Canadians. So what do we actually do at Cadth? So really, in short, Cadth delivers evidence, analysis, advice, and recommendations. So as I mentioned, we have a fairly wide variety of programs and services. So some of these people are very familiar with, some not so much, and some of these are evolving right now too. So I thought I'd go through these a little bit and give a little bit of understanding, and then we can go a little more into a discussion about what direction Cadth is going. So to start off, we have our drug reimbursement recommendations. So our common drug review and our pan-Canadian oncology drug review, which we call PCODR because otherwise it's a mouthful. So really, those two programs review drugs and make reimbursement recommendations to Canada's federal, provincial, and territorial public drug plans to guide the drug funding decisions. Then we move on to our health technology management programs. So we have our rapid response service, which people are fairly well familiarized with, it seems. And rapid response is our fastest and most flexible product, I guess. We handle questions related to prescription drugs, diagnostic tests, surgical, medical, dental devices, procedures, really anything that can be defined as a health technology, with the exception of not those broad health system issues such as information technology, program delivery, staffing, and finance. We don't include those within the scope of our rapid response service. With our rapid response service, there's again a variety of topics and products that we can provide. So we always do that again through dialogue with our customer. It depends on their information needs, as well as what the timeline is. So we can do anything as simple as a reference list, so we can turn around in a fairly short time period if somebody requires, or we can produce a fairly robust report that is critically appraised and summarized based on the information. But again, that requires a little bit longer timelines. So again, those are just things that we always work out with our customer. And just to note that anybody from the Canadian Health Ministry, Health Authority, hospitals, or federally, regionally administered healthcare programs can make a request to us through our rapid response service. So really anyone working in the public healthcare system. Just to kind of make note of how well that service is actually used in Saskatchewan, last year Cadth as an organization did about 300 rapid response requests, and over 50 of those were stemming from Saskatchewan. So it's fairly well utilized service from Saskatchewan, which is great to see. Next, move on to our health technology assessment service. So health technology assessment products are evaluations of clinical effectiveness, cost effectiveness, and also quite often include ethical, legal, and social implications of health technology. These products are very robust and extensive, and therefore take a fairly long time to produce. And they can involve either assessment of a new technology that is just coming onto market and just being utilized in our Canadian healthcare system, or it can be a reassessment of a technology that has been in use for quite some time. Moving on to our optimal use service, the primary purpose of an optimal use project, as it sounds, is to inform policy and practice decisions, as well as to encourage the appropriate use of health technologies by healthcare providers. So optimal use projects can encompass the use of a technology at any point in its life cycle, again, from that introduction into the life cycle or use. It may be reassessed later on throughout the life cycle of the technology because practices change. Maybe how it was used appropriately in the onset, maybe that's no longer the way that it should be. That technology should be used optimally any longer. And quite often, or the odd time, as you move through that life cycle, there may have now been different technologies that have taken the place. And by reassessing that technology, it may actually lead to a decreased use of the first technology. And so optimal use does change over time. Optimal use reports are very similar in scope to our health technology assessment reports, with the exception that they also include recommendations from an expert committee. So again, these reports are very robust and resource intensive. And for that reason, they generally, topics that are chosen for these projects are generally those of a pan-Canadian interest that can be applied nationally. So I will go a little bit more into the knowledge mobilization side of things after, but with our health technology assessment reports or optimal use reports, we have knowledge mobilization efforts that coincide with them where we develop implementation tools. So whether it be tools for patients, tools for providers, or whatnot, to assist in implementing and utilizing that information. Many people are familiar with environmental scanning. We at Cadth do that as well. Fresh evidence emerges daily, patient needs change, technologies change, and given that context, it's sometimes difficult to assess whether healthcare technologies are actually being used appropriately. So quite often we will conduct environmental scans of healthcare practices, processes, protocols. This may be within jurisdictions within Canada, may be beyond Canada also, to inform decision makers about the use of how these technologies are being used, particularly with the goal of identifying where there is variance in the use of these technologies and policy gaps. What's quite helpful is that sometimes these environmental scans, through identifying these gaps, will also help us to identify further projects that we may want to then use for health technology assessment or optimal use projects also. We also do horizon scanning, which is not one of the areas that is really well known, but Cadth does scan and monitor various health information sources to identify promising technologies that are not yet widely being used in Canada. These technologies are usually those that we foresee as being likely to have a significant impact on healthcare in Canada. So our horizon scanning publications summarize information about a technology, including the evidence, the regulatory status, the potential costs, and any concurrent developments and implementation issues. So usually when we do our horizon scanning, we're interested in technologies that might still be 1 to 3 years away from being licensed in Canada, or those that are in the early phase of use in Canada. We then have our scientific advice program, which is aimed mainly at the pharmaceutical companies and giving them advice early on in their drug development plans from a health technology assessment perspective, and our knowledge mobilization and liaison officers. So that's one area that I am going to go a little bit further into discussion on. I know many people are very familiar, especially with our liaison officers in Saskatchewan. Kathleen has been around for quite some time, and Allison for the period right now, who's doing a fantastic job filling in. And the liaison officers have always been located in various jurisdictions across Canada with the goal of connecting and working with different healthcare providers in the local jurisdiction to understand their needs, and then liaise with Cadth as a whole to see how we can support and how we can meet those needs. Quite often that might be through submitting those rapid response requests. It may be through doing presentations the odd time. Last year, for example, I believe we did about 15 to 20 critical appraisal workshops, or Kathleen went out and taught different healthcare providers the basics in how to do critical appraisal when they're reading research. So a fairly extensive role that they have. As I mentioned, that's going to be adapting, or is adapting, with our transition at Cadth from a health technology assessment to a health technology management organization. So going away from just knowledge mobilization liaison officers to more of an implementation support team, which I will go into further. So I keep talking about health technologies, so it's really good, probably, opportunity to define what I'm talking about. So within Cadth, we usually talk about our drug versus our non-drug health technologies. So drug would obviously be our pharmaceuticals, our biologics, our blood products, our vaccines, any prescription and non-prescription medications. And then on our non-drug side of things, we have those clinical interventions, whether they be medical, dental, surgical devices. If you want to look at the mental health realm, we have our psychological and behavioral interventions. And we also include our diagnostics, whether it be laboratory tests, screening programs, or our imaging. So we at Cadth, when we talk about a health technology, really we're talking about anything that is intended to achieve a health outcome. So as I mentioned, Cadth is in a state of transition, and we are moving away from a health technology assessment organization to health technology management. So we recently released our 2018-2021 strategic plan, and the big change in this plan for Cadth going forward was that transition. So traditionally, Cadth's role has been to provide completed reports summarizing the evidence. Potentially may include some recommendations depending on the type of report that have been formed by an expert committee, and some limited capacity for knowledge mobilization. It was identified that there is room to close that gap between the evidence and practice, and that we did an exceptional job at providing the evidence, but there was a limited support going forward as to how that evidence actually got put into practice, which explains some of that move towards the health technology management side of things. So, in that being said, as we transition to that, we're looking to strengthen that evidence to action connection and expand the breadth and scope of the products we offer and the reviews we do, become more integrated in the healthcare system, and assist in all points of the technology lifecycle. So not just producing those reports, but also providing the implementation support side things as well. So again, just like I already alluded to what health technology management is, but again, just providing more emphasis on contextualization and implementation support, and focusing more on the life cycle of the drug or technology versus what was previously done with the focus of assessment at the point of adoption. So within Saskatchewan, we actually were the start of Cadth's first implementation support team, which is now being duplicated in other jurisdictions also. So it was a great opportunity to bring some additional capacity within the province, and for us to be able to now have capacity to work collaboratively with our new SHA, with the Ministry of Health, with the Cancer Agency, work with various healthcare providers and other organizations and associations to help look at what are the local needs, both near and in the long term, and how can we support those. So again, that's with us positioning ourselves to offer a broader range of services to support these local needs. So just some examples of where we see that we can provide the support is through policy support, rapid literature reviews, innovative or specific knowledge mobilization or educational tools. We also now have the capacity that we can be involved in working groups and projects over the long term, that we can facilitate conversations, provide presentations to actually bring that, help groups understand and consider what the evidence says and how we can best respond to that evidence. So not that I would ever encourage anybody even to try and figure this out or to try and remember it, but I just wanted to provide an example. Whenever anybody has any questions, we always just contact anyone, the Cadth representatives in Saskatchewan, whether it be myself, whether it be a liaison officer or the implementation support officer. Any of us are willing to assist. And if we're not the right individual, well, we can identify who is and forward that on. So within Saskatchewan, there's actually 3 of us now from Cadth. We have our liaison officer that I mentioned before. So right now it's Allison Friedman, who's filling in for Kathleen Kulik. And the liaison officer, as it has traditionally been, will continue for the most part to be that first connection that most people do have with Cadth. So they're still going to be the ones that are going out to the conferences, that are coordinating events, and things like that. We now have an implementation support officer as well, who is able to help identify opportunities where we can provide maybe further tools to support implementation. So whether it be educational materials for patients, for providers, or such. And then myself as the program advisor, who can be engaged with policymakers or provincial groups and committees on that higher level to look at the more widespread initiatives. So again, providing policy support, consultation, etc. So when we think within ourselves as to how those all fit together, because they're very intertwined and is kind of confusing, point-of-care testing is a great example that's easy to use because, as we all know, point-of-care testing is a topic that's resonating in a lot of jurisdictions right now and has evolved quite a bit over the last few years. And it's an area that has a lot of really defined discrete technologies or tests that can now be done or offered via point-of-care testing. But there's also that overarching policy perspective from a point-of-care testing program, as far as scope of practice concerns, quality assurance concerns, and such. So if we want to look at Cadth as a whole, the liaison officer, again, usually the first point of contact if people have their questions that they're looking for information on. If we're looking at information as far as the different technologies and tests that can be done via point-of-care testing, Cadth has a point-of-care evidence bundle where we have compiled all the work that we have done, the reports we have done, and put it all together in one nice, neat little package for people. So that's available. Our implementation support officer is more than happy to help develop tools to help implement that research. And myself as a program advisor, I would be more that higher level umbrella, helping look at, again, the development of a point-of-care testing program with the scope of practice concerns, quality assurance concerns, and such. So that being said, I wanted to throw this in because, like I have said, we have our rapid response service, which is very well utilized. But everything we do, because we are publicly funded, is also publicly available. So really, our evidence is your evidence. Any work that we have done, whether it has been for a customer in another jurisdiction, it is still published on our website online. So I would encourage almost anybody, if you're ever looking for information and you want credible, good quality information, if you want a quick and easy stop, you can always go to our website. It's just cadth.ca. It's really simple to find. And like anybody else, we have our little search box, and you can put in the keyword of what you're searching for and see if we have done any work on that topic. If you don't want to do that, you're always welcome to contact one of us and talk about what you're working on at the time or what your issue is that you're looking for information on. And we can look and see what work we have already done and provide that for you, or we can see what products or services we can provide that may be of use. If we have done reports, whether you find them or we find them, and we have done reports previously, and maybe they're a couple years old, if it's something that we feel would be beneficial, we can always submit a request and have our team actually review that report again and have it updated, which is quite helpful, especially in our healthcare realm where things change rapidly. A report from 3-4 years ago may no longer be relevant, so we may want to have that updated if it's of use. We can also look at reports that we have done, and if it's still not, providing quite the information that somebody needs, we can then resubmit and ask for that information to be expanded to provide what they're looking for. So lots of opportunity. I always encourage people, it's a really quick place to look. I had mentioned those evidence bundles also. So I put it on here because it's kind of challenging, I think, to find on our website. But again, if you do go to cadth.ca, you can just click resources at the top. And then when you'll get to this page, and you'll see evidence bundles on the left-hand side, and you can just click that, and it will list all the evidence bundles we have done. So again, any of the topics that we seem to keep producing work on, as we do it, we will add that work to these bundles. So it's kind of a quick place to look for a lot of the work that we have done on specific topics. So obviously diabetes management, prescription drug use, mental health, long-term care, opioids, cannabis, a lot of the hot topics right now. So obviously Cadth has done a lot of work in these areas. So it's kind of a one-stop shop. You can click those evidence bundles and see a lot of the different reports that we have produced. And again, it's always a great opportunity to go there. If you don't find what you're looking for, we can always do that also. So now that we've kind of gone through all the different types of projects and work that we do, I thought I would just do a quick overload of some of the work that we have done recently and are currently working on. So as I mentioned, our optimal use and health technology assessment projects, those are our very large scale, robust projects that are quite labor intensive and take quite a bit of time. Recently, we've completed 2 of those. So optimal strategies for the diagnosis of acute PE. That's a great one in terms of looking at the optimal care pathway for diagnosis of acute PE. What should be ordered? When should it be ordered? So, from your D-dimer to your diagnostic imaging and looking at what should be ordered when and what the most appropriate channel is. I thought that one was really interesting. We also have appropriate use of interventions for adults with insomnia disorder, another widespread concern. Recently, we've completed 2 environmental scans as well, looking at opioids and central nervous system depressant drugs together, as well as characteristics of remote and isolated managed healthcare facilities. That's interesting for the fact that there's such a variance in the type of facilities across Canada, especially in the rural and remote areas, and the types of work done in those areas. As I also mentioned, our evidence is your evidence. So if we have done work on a topic, regardless of what jurisdiction it's from, we will post on our website, so it's available for everybody. So even if we've done one of those quick rapid responses for somebody in another jurisdiction, that will also be available. We don't identify who requested it, but it will be available. So this is just a list of some of the recent rapid response reports that we have completed. This changes almost daily. So again, if you're ever looking for something, I encourage just go online and look, because like I said, these rapid responses, we have a short turnaround time on them. So we do complete them in a fairly short time frame. And we also do always list our projects that are in progress as well. So this was actually taken a couple days ago, and you can see there's a wide variety of topics that we're currently working on right now. Some of these may be those larger scale projects like our environmental scans, right down to some just a rapid response, those ones that we turn around in a short period of time. So again, this changes daily. If you went on our website today and looked at reports in progress, some of these will still be in progress, some of these will be completed, but you will find a whole host more. So even if we are currently working on something, if you search it, if somebody has put in a request and we're working on it, it will also show up there as well. But again, you can always contact one of us and we can look at what we do have in progress and whether it will meet your needs or not. So again, a wide variety of topics that we're looking at. A lot of that rural and remote, because that's still a hot topic for everybody, and the opioids, which will be added obviously to our evidence bundle when complete as well. So I think that is really my presentation for today. I just really wanted to do an overview of who Cadth is, what we do, what we are now transitioning into, and what we can do. So I hope that was helpful, but also provide some context as to how you can access Cadth resources. So as you saw, it's all online. You're more than welcome to do it, but I would also encourage you contact any one of us at any time, because like I said, sometimes we have ideas as to support that we can offer or resources that we can offer that may not be accessible on our website. So if you have a project that you're working on or you have a need, I mean, we're more than happy to come and meet with you and have a quick talk about how we might be able to help. So either the liaison officers or myself are more than happy to do that. And I think that is my presentation today.
That's wonderful, Krista. Thank you so much. I'm very confident that that'll be a very helpful resource for any of our members that are able to access this webinar in the future. So thank you very much for your time. I want to also just mention that next week's webinar topic is the toolkit for managers of RNs, and it will be presented by Terry Belcourt and by me. If you missed a webinar, you can always access them on the SRNA's Vimeo or YouTube channels. So thanks again, Krista, for joining us today and for your wonderful presentation, and we'll see you next time.
Thank you.
Thank you.